Joe Biden used the national crisis that we're currently going through to argue against universal health care.
Experts are saying the only true way to control this virus is through a national quarantine, requiring every American other than essential personnel to stay home. Would you take that unprecedented step of a national lockdown?
What I would do is what we did in our administration. I would call a meeting in the Situation Room of all the experts in America dealing with this crisis. I would sit them down and I would do exactly what we did then. What is it that we need? Listen to the experts. What do we need? And with all due respect to Medicare for all, you have a single payer system in Italy. It doesn't work there. It has nothing to do with Medicare for all. That would not solve the problem at all. We can take care of that right now by making sure that no one has to pay for treatment, period, because of the crisis. No one has to pay for whatever drugs are needed, period, because of the crisis. No one has to pay for hospitalization because of the crisis, period. That is a national emergency, and that's how it's handled. It is not working in Italy right now, and they have a single-payer system.
Notice what he did there. He said, the single-payer system is not going to fix this. Anyway, so nobody should have to pay for treatment, nobody should have to pay for drugs, and nobody should have to pay for the hospitalization. Joe, that's what a single-payer system is. That's what a single-payer system is. If you're saying they don't have to pay for it, who's going to pay for it? The government, the taxpayers. Well, that's exactly what a single-payer system is. Complete contradiction. Complete contradiction. Single-payer is not the thing that's going to work and going to fix this. Anyway, what we need to do is single-payer. I can't, bro. I can't deal with this. I can't. And Bernie's response, by the way, wasn't great. But that's what he should have said. He should have said, you just said we can't do single-payer, then you propose single-payer. The answer is yes. And a point that many other people have made is, it's great that you're seeing the light when it comes to this particular illness, but if somebody's going bankrupt because of, cancer bills, that's also a national emergency to them. So, why are we picking and choosing among, different ways of getting sick? What's covered and what's not covered? Cover it all. Cover it all. Take the same principle you're applying for this crisis and just do it across the board for healthcare. And that's what every other developed country does. Now, to his point, the system is not working in Italy. The problem is they didn't quarantine soon enough in Italy. So it kept spreading and spreading and spreading and spreading and spreading. And it got to the point where the healthcare system is overburdened. And, that's, if you don't get it early enough and you don't quarantine and lock down early enough, that's going to happen anywhere. Because there's not, it's not like there's an ICU bed for the exact number of people you have in the country. You know what I mean? Like, that's the only way you can make it so we're not overburdened. Have a doctor for every person and have the same number of beds as there are citizens in the country. So the problem isn't the single-payer system. The problem is they didn't lock down and quarantine early enough, so the system got overburdened. Furthermore, the countries that are handling it the best have single-payer systems or have universal healthcare systems. South Korea is handling this better than almost anybody. Taiwan and Singapore are doing amazing as well. But South Korea locked down very quickly. Unfortunately, there was one person that spread it to an entire congregation of people, which led to the further outbreak. But they were able to get it under control, and they have a single-payer system, and they locked down relatively early, and they have way more beds, ICU beds there than we do here. So you need both of those things. You need to lock down early to make sure it doesn't spread, and you need a single-payer system to make sure, people aren't devastated by this. And so what Trump did is he announced, the treatment for this will be free. He did that in his Oval Office address. Then the health insurance companies came out and said, no, we didn't say that. We said the test will be free. So we went from treatment being free to no, it's just the tests, to now I'm seeing stories of, even though they say, the test is free, they're still charging $185 in some places. And they're saying, the test was free, but the labor for the, clinicians to look at the results of the test and pass it to you, that costs money. So, guys, listen, I don't know how to make this case other than to say, yes, in a healthcare crisis, you want the healthcare candidate. Yes, you want to make it so that, imagine what we have right now, which is the treatment is not covered. How many people are going to go bankrupt as a result of this? How many people are going to be able to afford the medical bills? because we don't have paid sick leave for everybody and we don't have Medicare for all, for the longest time now, we've been dragging our feet. And what's been happening? Somebody wakes up in the morning, I don't feel too good. But what am I going to do? I got to pay the mortgage. I got to pay the light bill. I got to do what I got to do. I got to go to work. So they go to work. They don't have paid sick leave. They're feeling symptoms. They go to work. They infect a whole bunch of people. And it was all because they didn't have the paid sick leave and they can't afford the medical bills. So, yes, the answer is a single-payer Medicare for all system. Duh. And it's also quarantining and locking down at the right time to flatten the curve. Those are the answers. Anything outside of that is BS. Anything outside of that is people overcomplicating it. Or in the case of Biden, trying to obfuscate and distract. Oh, single payer is not the way to go. And that's why I think we should have free treatment, free testing, and no charging for the hospital stays and no charging for the drugs. That's single payer. That's single payer. That's single payer. So our country is in a uniquely bad situation. Don't take my word for it, take the experts for it. The experts say they don't have a national healthcare system in the U.S. They're going to get hit. We might get hit harder than anybody, except maybe Iran, because Iran, we're sanctioning them, so they're not getting like a lot of basic things that they need, like doctors need masks and more ventilators. We might be, second to only Iran in terms of how bad it is here, because we've dragged our feet repeatedly. We cut the CDC, we cut Health and Human Services, we got rid of the pandemic experts. We're already behind. The administration was pretending for the longest time that it's contained. It wasn't remotely contained. Now it's spreading like wildfire. Still, the medical bills are not going to be paid for sure. So it's amazing to me that even in a time of a pandemic, you have people saying, hey, maybe a national healthcare system is not the way to go. It is the only way to go for us to have any chance. Guys, you need that coordination from the top down in a situation like this. You can't leave it to this, fractured, scattershot system where it's a mess. You need that coordination. You need that, centralization in order to implement policies and changes immediately. So this is, it's really infuriating to watch somebody like Joe Biden say a universal healthcare system wouldn't help in a pandemic. Jesus Christ, man. That's so dishonest. And that's such an evil thing to say. He's so committed to neoliberal politics that he can't help himself. Even in the midst of a pandemic, he's like, yeah, giving everybody health care is, that wouldn't fix it. Certainly one of the things we need to do to help fix it, along with locking down earlier. So there you have it. He says single payer is not the answer as he calls for single payer solutions. Great. Now just expand that mindset beyond just this virus and you're there.